Welcome, everybody, and good morning. Thank you for joining us here. It's nice to see a full room. I was just saying in the green room, you know, at a time where the dialogue around here is dominated by Greenland and tariffs and clashes, it's refreshing to keep the conversation focused on how to make the world a better place. And that's why we're here today, to talk about healthcare and AI and the exciting convergence when it comes to what the world holds for public health because of this game-changing technology. We've got the perfect panel here, all people who know each other, work together, and are working for the greater good here on this healthcare issue. Bill Gates, needs no introduction, co-founder of Microsoft, chair of the Gates Foundation, one of the largest and most influential philanthropies, core mission, public health. We have Paula Ingabire, she's the Minister of Information Communication Technology for Rwanda, and we have Peter Sands, who is former head of Standard Chartered, but now leads about 8 years the Global Fund when it comes to fighting disease. So thank you all for the conversation. And you know, usually a conversation around public health, we talk about all the problems, you know, the shortage of healthcare workers, the access to funding right now, the inequality. And I think we can do that, but I'm excited to say we can also talk about solutions now and what AI is doing to help solve some of those problems. So Bill, I think we should start with some news, which is a good way to start, because you're announcing today a partnership and investment with OpenAI around Rwanda in global health. Did you do this for us today for the panel?
Sure.
Or for the world?
Yeah, so when people think about AI in healthcare, you know, they're deeply aware that AI is going to help on the discovery side because AI can model complex disease processes and protein shapes, and so it's going to accelerate new tools being available. But I would say it's even more important that AI will be used on the delivery side. And that's true in rich countries, but it's even more true in developing countries where you're never going to have enough doctors or clinicians to deal with the demand manually. And so the AI is entering into the health system, but not just into the health system, it's all the way down to the level of the patient. So the patient is able to talk in their local language and describe what's going on. And so in order to make this a reality, to see what works, what doesn't work, we're thrilled that OpenAI and the Gates Foundation are committing an initiative called Horizon 1000, where we'll go into 1,000 primary healthcare clinics in Africa. And the goal is to make the work there much higher quality and, if possible, twice as efficient as it is today, taking away the paperwork that needs to be done, organizing the resources, so the patient knows what's available and when to come for their appointment. So there's all sorts of things can be improved. Rwanda has been a great partner for the Gates Foundation in a lot of things, and so we're thrilled that that's actually the first country that this work will go into. We'll certainly also, over time, work in Kenya, South Africa, Nigeria, and you have different systems that we have to connect into. Although not this initiative, there's obviously a lot going on in India as well. And so, over the next couple of years, I would expect developing world health may even get ahead of rich world because the need is so great, and the governments are embracing this and making sure that it's moving at full speed.
And it's getting attention. I mean, the fact that OpenAI is involved, I haven't really seen them do partnerships like this. Do you expect some of the other big AI companies to follow suit?
Yeah, so, the Gates Foundation, we have a great relationship with Microsoft, with Google.
Wonder why.
With Anthropic. No, but I talked to, Sam, Dario, Demas, a lot, and Mustafa at Microsoft. And, so it's wonderful for me that the help and advice I'm giving on these AI issues makes me well informed about how we're using it for our three big scenarios. And our big scenarios are virtual tutor for education, virtual doctor for healthcare, connecting into the health system, and finally a virtual agricultural advisor to some people, this is the most obscure, but equal importance, so that the poorest farmer in the world gets the same quality of advice as a rich farmer. And so we'll mix and match. OpenAI is a little bit unique in that a quarter of their company is owned by a foundation. And so if you actually say, okay, what's that worth? It almost matches the $200 billion in assets that the Gates Foundation is going to be expending over the next 20 years as we, finish our work during that time period.
Yeah, I always thought it was odd that they were structured as a nonprofit, and now I guess there's purpose behind that. So it's nice.
they have a complex structure.
They haven't really operated like a nonprofit.
Well, they're increasing. You'll see more and more from them on the philanthropic side. This is one of the first initiatives. Sam and I have been talking about this. We have regular meetings. They're staffing up the foundation side some, and so I'm really pleased that developing world health in a very concrete way is actually the first initiative that is purely philanthropic. And the 50 million commitment here is just the beginning. I believe that people in Africa should have this health advisor without having to pay anything for it. It should just be a basic capability available to them. And then as you go into the health system, instead of filling out paperwork and redescribing everything, the AI that you've been talking to is summarizing that. And so it's kind of a digital EHR, getting rid of the paperwork together with all the intelligence.
Minister, a big deal for Rwanda. I mean, obviously, congratulations on being the first with this. You have also helped make this country a leader in both healthcare and AI. How did that happen?
I think for us it's been very clear that technology was going to play a very central role in the different facets of our development as a country. And so with limited natural resources, I think technology becomes a natural go-to and not an afterthought. And so we've embedded that over the last 20 plus years in how we're building some of the foundational digital infrastructure that is enabling and powering some of these advancements, whether it's in healthcare, agriculture, education, and many other sectors. And particularly when it comes to AI, when we started thinking about how, as a country as Rwanda, we can leverage AI for development, we had to think about where do we have our biggest pain points as a country, and where do we think AI is going to play a role in responding to some of these challenges. So access to quality healthcare, ranked high, access to quality education as well, and making sure, because we have the biggest number of our population is, within the agriculture sector, making sure that they can have access, better access to tools that allow for better productivity, at the same time addressing food security concerns that we are trying to address as a country. But particularly for healthcare, and we're very grateful that the Gates Foundation has really chosen Rwanda to be one of the countries where they start this engagement with OpenAI. And what we're looking to do is creating decision support tools for our 60,000 plus community health workers that provide, primary health care to our communities across the country. And to Bill's point, there's also a conversation that is going on with Anthropic as well, to see how we can have an instant health intelligence platform that then feeds into, the entire national health planning systems and allows us to allocate better resources. And so we're very confident that AI is going to deliver these gains. When we started off for Rwanda, we're looking at the fact that when you look at the patient-doctor ratio, the numbers were really alarming. I was talking to Peter earlier. We came up with a strategy to have we call it 4x4 strategy. And so the idea was to quadruple the healthcare workforce within 4 years. We're 2 years down the road. We've already, from an enrollment perspective, we are already at 3.8 of the workforce. And so, which means within the next remaining 2 years, we should be able to quadruple our workforce. But then again, they're going to need these tools to support with better care delivery, to ensure that some of the administrative tasks that they've been, working on, we can use AI to do that, so they are more focused on delivering, better and targeted care to our people. And so we're looking forward to, creating more partnerships, piloting, but also most importantly, scaling these solutions across the country so that we deliver the gains that we're looking for.
That was a good tease for an Anthropic. Now they're going to all compete with each other to try to do this, which is great for you. How do you do AI? I mean, do you guys have data centers? Do you use the American models only? Do you use the Chinese models? How does that work?
So for us, we've looked at a couple of things. We are a country where, when we started this digital transformation journey as a country, it's more than 15 years ago. So I did speak earlier and mentioned we had a lot of data at rest that we're not using. And so the starting point, when you talk about AI, what fuels AI is data. And so we had to go back and look at what kind of data sets do we have, building a national data hub, building national data intelligence platforms that help us with that was very critical, because then once we build these models, they need to be trained on our own data, they need to be context specific, and they need to be coming in to address a real problem. And then the second one is really to look at all different models and see which one is a good fit for what we are trying to address and use it to train. Obviously, there's efforts down the road to be able to create our very own models, but we don't have to boil the ocean at this point in time. If there are models that are already available, open source, we can use those, as long as we make sure that we have the right data sets and we're removing and paying attention to the biases that could come through if we don't feed the right data into these models.